Atrial fibrillation is the most common abnormal heart rhythm, and it is an irregular heart rhythm beginning in the top chamber of the heart that causes people to feel palpitations, heart racing. Atrial fibrillation is not really considered a life-threatening condition, but it can progress to more concerning type of situations and should be evaluated. Atrial fibrillation is very common, and it is more prevalent in people who have diabetes, hypertension, underlying heart disease like congestive heart failure, heart valve disorders. People who drink a lot of alcohol are more prone to having atrial fibrillation, and it does tend to run in families. The sheer number of people that have atrial fibrillation, it's somewhat hard to know exactly what the cause is. The symptoms of atrial fibrillation can vary from no symptoms. In fact, we're getting a lot of people who know they have atrial fibrillation only because of smartwatches that they're wearing or incidentally found at office visits with other doctors, to very severe symptoms. People can have palpitations, shortness of breath, chest pain, dizziness, fainting, and anywhere in between. Atrial fibrillation, we believe, is not one of the life-threatening heart conditions. However, it can increase your risk of having a stroke, and it can also lead to congestive heart failure over time, so it is important that those things are prevented with certain medications. Atrial fibrillation, we hesitate to say is curable. There are very good treatments, including medications, and catheter ablation is now one of the more common procedures that we do in my practice, and it is a procedure that we use more so in younger people and very symptomatic people with atrial fibrillation. It gives us a great success rate. It is more successful than medicines in treating atrial fibrillation. However, it's not 100% successful. In general, if you have a history of atrial fibrillation, you have to be on the lookout that it may come back at any time, even after these procedures.